Go. Good evening, here from Jerusalem, headquarters of United Hatzalah. Right behind me is the National Dispatcher, where we're responding to live calls right now. I'm Dovie Maisel, Vice President of Operations for the organization, and here in Jerusalem, 8 o'clock in the evening, sharing this live Q&A with you everywhere, all the people joining us this evening. I want to thank you. I also want to take this opportunity and wish Eli Beer, our president and founder, a refuah shlema, and get well really, really quick. And yeah, I'll give you sort of a live update of the status as of now in Israel in general and in United Hatzalah in specifics. And I hope that I'll be able to share this information with you and answer your questions as we go along in this session. So, as of now, Israel is undergoing many different. Sorry about that. And we're back. The radio doesn't stop here. Yeah, so like we all know, coronavirus outbreak in Israel and globally. So here in Israel, we've been dealing with the corona outbreak for the past few weeks, and the government has taken some severe measures, extreme measures, in order to try and prevent the expansion of this outbreak, meaning most people in Israel today are not working in their workplaces, ordered to stay at home, go out only for essentials, meaning to the doctor, if it's an emergency only, to the emergency room, go out and buy essential necessities like food, medication, things like that. Most of the government offices have been shut down and moved to work online, etc. There are no official limitations on movement, meaning there are no police cars on the streets stopping people from going, but the general public, I think, are starting really taking this seriously and simply staying home. At the moment, in official quarantine, there are approximately 55,000 people in official quarantine, those who have been exposed to coronavirus patients, those who have come back from abroad. Anyone who comes into Israel immediately needs to go into 14-day quarantine, and there are about 430 diagnosed people that have been tested positive for corona here in Israel and are being treated. Of them, there are 6 in serious condition, ICU units, etc. 11 that are in moderate condition, and the rest are in a more or less light situation and being treated for this. 11 people have overcome and been discharged to their homes. So I would say that in the past week and a half, since these measures have gone into effect, there's been a high level of anxiety and stress in Israeli society. People calling emergency services, calling United Hatzalah headquarters dispatch center that is right behind us over here, and asking many questions about the corona. The government has their official hotline, which is a *5400 for any information. And those people who are suspected to be corona patients are getting tested at home and getting their answer within 24 to 48 hours. In order to try and find those people who have been exposed to their track of where they've been, their epidemiological track, in order to notify the public that people who have been in their track and have been exposed to them that need to go into quarantine, we released Saturday night a very unique app called Alltrack Virus. Alltrack Virus is an app that anyone can download for free. What it does is basically is on your phone, it tracks every step you take and every 2 minutes. And it doesn't share this information with the cloud or anywhere else. So as far as personal privacy issues and things like that, this information is kept in your phone alone. And if for some reason, in the information that we get from the Ministry of Health, notifying what the track is of people who have been affected by corona, so what the app does, it takes the 2 layers and puts them one on top of another. Information coming from the Ministry of Health and the information based in your app. And if there's a meeting of the 2, then immediately we'll give you a push notification saying that you have been in a location, and we'll tell you what location it is, that there was a diagnosed coronavirus patient, and it will refer you to the Ministry of Health. Then after that, immediately you can export from your phone willingly, only on your own. Nobody can take this information without your permission. Nobody has faraway servers that can enter your phone. What you have to do is actually export a file from the app which will give your epidemiological track of every place that you have been in the past 14 days or since you installed the app. And this way saving precious hours. Like I said, 24, 48 hours until they even find the track of where you've been, etc. And this way, really quickly, other people who have been affected will be notified of and get them into quarantine to prevent further exposure and getting other people with corona. In general, the challenges here are great for many reasons because, first of all, there's the big uncertainty of the situation that's going on. What's going to happen? We're all tracking what's going on in Europe and Italy and the US, and of course what happened in China, Korea, and other countries. This is, I think, a very unique situation, unprecedented, at least not in modern history, a pandemic of this scale, and as such, people are in uncertainty, and uncertainty is what leads to anxiety. And I think that the most important message here for the people in Israel is really stay in your homes. Stay in your homes, and social distance, I think is what the term that they're using today, is very important. Keep that 6 feet, 2 meter. It's like one hand in the air and your other friend hand in the air, and that's the distance that we need to keep from each other. Minimize our social interactions, and this way will prevent the further expansion of this outbreak. That said, there are still car accidents, there are still heart attacks, there are still strokes and children choking. And these are all responded to by United Hatzalah volunteers. They are being dispatched from this room right behind me to these calls about 1,800 times every single day. And what we've done is, because of the coronavirus threat, what we did was we actually equipped all of our volunteers with special protective kits that cover their body head to toe, masks and protective shields of the face, etc. And if there's any threat or suspicion that this is a corona patient, then they will obviously gear up and protect themselves in order to treat that person and try and save their life. That said, it is a very stressful situation, not only for the people themselves, but also for our volunteers. And still, they are going out and responding to the calls. Every single day, within 90 seconds, 1,000 motorcycles, ambucycles are out there saving lives. And the total of 6,000 volunteers are out there. Amongst those 6,000 volunteers, we also have dozens of volunteers that are in quarantine already for many different reasons, not necessarily being exposed to patients. Of course, yes, there are those who were exposed to patients, but others that were coming back from a vacation abroad or business or whatever it is, and were put into quarantine. The threat of quarantine and infection of our teams, our volunteers and our staff members is great, and therefore we took extreme measures as well, meaning the dispatch center that we see behind us, which is usually manned with up to 21 dispatchers right next to each other. What we did was we opened up the emergency dispatch center, which is in our underground complex in the miklat, in the shelter, in the bomb shelter, and actually we've created distance. A 6 feet distance between each dispatcher to another within the room here and the ones downstairs. We've also limited the access to our headquarter building in Jerusalem. No one is allowed to enter this building, not visitors, and not even volunteers themselves. Volunteers themselves cannot enter this building for the very simple reason we want to protect our dispatchers back here and minimize the risk of their being exposed to any sort of corona threat, and enabling us to continue operations throughout this process. So, Robert, to your question, why the Ministry of Health doesn't force MADA to work with us, with United Hatzalah, I think that I can't answer on behalf of the Ministry of Health. I know that the Minister of Health on one of the media outlets spoke about them choosing to work with MADA or whatever it is. But I think that when we look at the challenges here, this is an unprecedented historical challenge that we're facing here. So even if the Ministry of Health decided to, quote unquote, choose MADA and not us, inevitably there is no choice. There's no choice. Our volunteers are every single day out there. They're responding to the calls, and with the support of donors, we've been able to equip our volunteers with the basic amount of protective gear and of course, support of people is very important here, so we can keep equipping them with this equipment, because they are going out there. They're out there, the heart attacks, the choking victims, car accidents, etc., because these don't stop. We are in discussions with the Ministry of Health and getting the guidance of the official protocols of the government of what we're supposed to be operating with. That said, we are working with other government agencies, Ministry of Defense, Police Ministry, etc., and of course working within the elderly public, which is being significantly neglected and being the most in risk group of patients to coronavirus. Then we, through our project called Ten Kavod, we're expanding that and getting people within the community to respond and help. And we're getting actually very good traction within these other government offices, where in times like this, we called upon the Ministry of Health and upon Magen David Adom to put aside any differences and work together for the better of the people of Israel. Marjorie. Hey, Marjorie, how are you? So why are non-essential stores still open? I think it's a matter of a process. Most of the stores have shut down. Only yesterday, this order came out. At the end of the day, there are 9 million people living in this country, and it's also a process that people need to understand, that you have to change the format that we're living in. We got to understand that we're going into a new era, a new time. It might take a month, it might take 2 months, it might take more. We hope that less, but I think it's people are getting used to it. I was going out on the roads today, in Jerusalem, in Tel Aviv, Petah Tikva, and there's no traffic. There's no traffic. The parking lots are empty. The shopping malls are closed. I think that as a society, we understand. The people of Israel understand the importance of staying at home. And I think it'll take a few more days until people settle into this new situation. We got to understand that thousands and thousands and thousands of people in Israel were actually laid off of their jobs because over 100 hotels were closed down. The whole tourism industry is shut down, and many other services. People have been ordered to work from home, and those companies that can't keep them are just letting them go. So I think it's a matter of a few days, and we'll be in this situation. And Jerry, good evening, Jerry. So as far as Palestinian Authority, our neighbors all around, I think just like every other country, and us as well, are sharing this. I know that the Ministry of Health, at least according to publications, are assisting and supporting them as well. We know of the outbreak in Bethlehem a couple of weeks ago that started there, and they actually were put on lockdown by Palestinian Authority, and the borders with Israel have been closed. Same goes for Gaza. In Yehuda and Shomron and Ramallah area, it is still under monitoring. I know that today there were a few thousand workers coming in from Palestinian Authority into Israel for work for a long period of time, knowing that they're not going back to their homes for the next couple of months, so they can continue working here and not bring back and forth the coronavirus to Israeli society. So the app that I mentioned, I'm trying to see, my site isn't all that good, so I'm going to take a look. So the app actually is available globally. The only problem is, Pippa, that the app has to be fed the information of the epidemiological tracks of where the people spent their past 14 days. Meaning, if a person was diagnosed with the coronavirus, with COVID-19, so what they do is they backtrack and try to find every stop they went, every supermarket that they went, every bus ride that they took, every train ride, etc., and then they put it into the Ministry of Health system. And what we do is we take that information that they're giving out to the public, and we're feeding it actually into the app. And this way the data is pushed to the phones and checked for that thing. I know that we've been approached by a number of governments, including some of the more affected countries, and we're trying to participate and cooperate with them in order to bring this everywhere. I think that this app can save millions of people around the world just by installing this app and getting the information fed in by the official services. So it's available, but if there isn't anyone feeding in that information, it won't be very effective. Regarding the App Store, we know that we're being asked many times. We didn't want to hold back because with Android and Google, it went much faster, and we went up in the air. We have over 100,000 downloads as of this afternoon, and we are consistently working with Apple to get them to put the app up on the App Store, and we're looking forward to it happening really, really soon. We believe that this will be able to help us get out to millions of people. Sarah, you're asking me if wearing masks and gloves really helps. So I think the simplest answer is there's no reason to panic with masks and gloves. The most important thing is, it sounds cliche, but wash your hands. Wash your hands for a full minute. Make sure you're doing it right. Go online, check out how to wash hands right for coronavirus on Google. You'll find plenty of examples. A minute of washing your hands effectively as many times a day as you can. Before food, after food, bathrooms, in and out, and all day long. Once again, the distance. The masks aren't very effective, and essentially, if you keep the social distance, and if you stay at home, then you won't need any of those. If you have to go out to the supermarket, you have to go out to the pharmacy, you do it, you keep the distance from people. You don't, as far as the Ministry of Health are releasing the notifications here, we don't need to put on masks and gloves on the street. So I know there's a big panic for all the alcohol gels and all of these other things. I think that most basic stuff that all of us have at home. We don't need to panic if they ran out of it at the pharmacy. All we have to do is just keep washing our hands and keep our social distance. I heard a great idea that was when you're in an elevator. I think they do this they practice in Taiwan and Korea. Is no talking in the elevator. Actually, the Ministry of Health recommended yesterday that not more than one person in the elevator at one time, but should you find yourself more than one, just no talking and try to keep your distance in the elevator. So hand sanitizers do help, but they don't come instead of washing your hands with soap and water. They'll help after you wash your hands. You can put them on, and it's always good to have them handy. Of course, it keeps our hands clean. We want to make sure to keep our hands clean. But I think they do make a difference. But I wouldn't panic if I can't get my hands on it because they ran out at the pharmacy. So Aviva, what precautions are we taking for the well-being and the safety of our dispatchers? So what we did was, like I mentioned earlier, for those of you who weren't with us when I started off, the dispatch center regularly has 21 dispatch posts, but those are about 3 feet away from each other. What we did was we divided the dispatch center to partially the one right behind us, the central one, and the additional one in the bomb shelter, giving us more. It's more like 6 to 7 feet between the dispatchers within the dispatch center in both dispatches. And more importantly, we've limited all our dispatchers. Of course, are United Hatzalah volunteers. They're all medics. On regular days, they'd be running calls between their shifts. And during these times, we ordered them already as of 2 weeks ago that anyone who's plays a role as a dispatcher is revoked of his right to go out on emergency calls. That is important in order to prevent exposure. We don't know what patient they're getting to. Is he a coronavirus patient? Is he not? Just the fact that he doesn't have symptoms doesn't mean that he's not that he's not been affected. And therefore, our dispatchers do not go out on emergency calls. They go directly with rides. They don't go on public transportation, and they're taking in direct rides from their home to the dispatch center and back and forth. And of course, no visitors. No visitors in the building. No visitors in the dispatch center. And we're doing the best that we can. So I think, Robert, great question. How can anyone support? I think the support is very, very important. You can see on the bottom of the page, we have a campaign page that we put up on our website. And for those of you who can just go in and look on our website as well, israelrescue.org, and you'll have a link from there. The support is very important. I can say that the support being done now is really targeted at the protective gear for our volunteers and the special equipment that we need in this unique time. We are not even aware how many we'll actually need. But we are positive and know that we will need it. So any and all support that can come from anyone will be greatly appreciated and will go directly to saving lives on the field. So, Carolyn, great question. Based on other countries, do we have predictions? So I can only say I have no personal predictions. What we're basing our predictions on is the protocol and game plan of the government. The government's Office of Emergency Management, Rachel, and the Prime Minister's office have their directive is looking at a process of approximately 2 to 3 months at least. What Prime Minister Benjamin Netanyahu said last night, and the head of the Ministry of Health have said that they're talking about the peak expected to be only in about a month. So we're talking about 30 days away from the peak. And this is based off of their calculations. So we're trying to prepare ourselves and our volunteers in many different ways. I think that it's also important to create a sustainable system for our volunteers so that they don't all suddenly get exposed at once and are out of action. So what we've done is we've implemented a procedure throughout all of our 6,000 volunteers throughout the country. They're divided into 80 units with over 300 teams. And what we've done is we've divided it into periods of 2 weeks at a time, where for 2 weeks at a time, some of the volunteers of the team will be divided into 2 or 3. And for the period of 2 weeks at a time, a group of those volunteers will not go out to any calls. So if within that period of time, some of the volunteers are exposed, they're either affected by corona or put into quarantine, then they will go out of service, and other volunteers which have not been exposed are able to go into service and continue operations. Wow, so that's a great question, Yael. Is the 14 days arbitrary number? Can the symptoms develop after 14 days? So I can say that as far as what the medical system is talking to us about is the 14-day quarantine gives us the ability, the symptoms can develop after 1 day, and they can develop on day 14. Based off of their research, it's shown that probably if it has not shown any symptoms after 14 days, then probably you've not developed it. That said, if you haven't actually done a test, and the tests aren't being given out to everyone, then you don't know. You might have, yes, been infected, but not developed symptoms. We know, based off of research and evidence around the world, is that thousands and thousands of people will be infected, but will actually not ever know about it because they won't develop symptoms. Obviously, the higher risk population is the elderly population, which are in higher risk. So there's been an order also in Israel here that kids do not go and visit your grandparents. Do video calls, do Skype, do whatever it is. Do not go and visit them because they might be sick and not even know it because they're not showing symptoms, and yet the elderly person will get that the infection from the child. So, can you go to a restaurant or go to a bar? Absolutely not. Those have been closed now for already, I think, about a week. All bars and restaurants are closed a little less than a week. And you can actually see it's actually quite scary going around on the roads. Everything is shut down. I was actually yesterday in Tel Aviv. We went to an emergency meeting with the government office, and I went by Azrieli Mall, and it looks like out of a zombie movie. It's just empty. The building is closed. Shopping malls are closed. Bars are closed. Everything is closed except for essential. Your local grocery is open, pharmacies and supermarkets, and in many of them, they're taking your temperature on your forehead to make sure that you're not carrying a temperature. And I think it's good for everyone. Just, take your temperature in the morning and in the evening. Take your temperature. We know we've ordered our dispatchers and our volunteers to do so just to make sure. If you're developing a temperature, you're automatically ordered into quarantine for 2 days until after you lose any and all symptoms that you had. So, no, can't go out. Only deliveries and takeaway. And even there, when you get a delivery service, the orders are that they need to leave it by your door and walk away, and only then you open your door in order to take it. So I think that at this point it's also important to mention, once again, our 10 Kavod program, which, like we said, the highest risk population for infection of a coronavirus are the elderly community. And our 10 Kavod program, which all year long, what they do is they come to the patient's house. These are elderly people that are alone, and our volunteer will go to their house once a week and take their vital signs, their blood pressure, their sugar level, etc. Take a look also in the refrigerator and in the bathroom, see that everything's working, see that everything is okay, and notify social services if needed, because we work with social services units within the municipalities. So nowadays, it's even more important. Why? Because the family doctor, the Kupat Cholim, what we call it, the HMO, are actually telling them, don't come in. Stay home. If you're not feeling well, stay home, call, and help will come. Help can take hours, and in some cases, can take even longer. It all depends on the availability of the services. So what we're doing is we're reinforcing this program of 10 Kavod and working with the municipalities, and actually offered some of the HMOs that are volunteers go to the patients' houses and assist them with these checkups. Their regular checkups. You know, they need to take their blood pressure, they need to see their sugar levels, etc., so that they can get their prescriptions, and they'll be assisted also with picking up their medication for them, etc., and making sure that they're not being left alone, especially in these times, because even if they have grandkids, they're not going to be coming by. All they have to do is sit home all day and watch that news channel all day long, telling them about this apocalypse, because that's what news likes to do. So we find it very, very important, and we're reinforcing that. Take out my jacket here. Yeah. So, ERs. Yes, ERs are very busy. Actually, what they've done in all of the hospitals is that the first triage to any patient that comes to the hospital before they even walk in the door is their question, and they're being ruled out for coronavirus. If there's any suspicion of coronavirus, they're diverted to a separate ER for corona patients, which is isolated and enables the teams, which are fully protected, to treat them. And the ERs, yes, they are definitely overloaded throughout the year, especially in the winter season. We all see constantly the news telling us about the hospitals being full and people being on beds in the corridor, and today even more. Except they're trying to get the people to stay at home, stay in the community. So Aviva, we are actually visiting them. The question is if how we're giving the support without physically visiting them. So we are actually visiting them in coordination and relevant protection. And those that are more tech savvy, if for lack of a better term, then yes, they'll be talking on the phone, on the cell phone, on a video call, and communicating with them. But those that aren't very hooked up to technology, then our volunteers will go to these people protected and pay them the visit, see what needs to be done, bring them whatever's needed, and help them out. So it is a challenge. By the way, just to mention, and back to that, one more note is that for the 10 Kavod program throughout the year, we usually have youth volunteers that are 16 and 17 years old that volunteer in this. Unfortunately, we have not been able to use them now, as the government said that anyone under 18 cannot participate in this program. I would encourage you to all help support the volunteers going out on the 10 Kavod program to protect them while they're going to visit these people. You can see the banner on the bottom running down here, telling us where to go to help support, protect the volunteers that are going to these people. And the highest risk is, and looking at Italy and looking at other countries, we see that the elderly community is going to be much more heavily affected than other communities. And that's why it's so important to get out there and get to these people and try and prevent the early deterioration or the early identification in order to make sure that they go and get their treatment for it. So, good question, Emma. How do people get their essentials if they are in quarantine? So, luckily in Israel, the online delivery services are very popular, and all the big supermarket chains have online services. They can order your food. Yes, you might need to wait another extra day or 2 or 3, as opposed to your regular. They can really get almost everything delivered. And if not, then you call a neighbor, you call a friend. They'll do the shopping for you. They'll put it by your door, walk away, and call you and tell you to open the door and take your stuff in. So I think that Israeli society are very much connected, and there's a very big, strong sense of community and responsibility for each other. So people are actually going out. There's been a beautiful initiative of people, babysitting for other people that are working for essential services, nurses in hospitals, etc. So that people are going to do like volunteer babysitting. We'll see where that goes now with even further limitations of nobody seeing anyone, basically. So getting prescription meds delivered. Well, essentially, if the person cannot come to the HMO or to the pharmacy themselves, then yes, the volunteer can go, the 10 Kavod volunteer can go and help and assist with that. It's not an official service. We don't want to turn into a service of deliveries for the pharmacies, but in general, the patients that are overseen by our volunteers, we'll try and help them out with whatever we can. And by the way, we see a beautiful initiative of almost all of the restaurants and services starting delivery services. So pharmacies and whatever, you can get the digital prescription today, and you can get people to deliver. So, Andrea, are pregnant women at higher risk? So, as publications are out by the medical services, the government, etc., there is no higher risk known at this point for pregnant women. That said, don't take any chances. Stay home, and of course, social distance, and that's it. I think that obviously we're always taking extra precautions when someone's pregnant. And of course, we feel more threatened and more vulnerable. But I think that if we really follow the rules of the hygiene and the social distance and just staying at home as much as we can and not needing to go out, then I think that you shouldn't be in any higher risk. Do you have a code that you say on the radio? Do we have a code that we say on the radio? So no, actually, I think it's just very, very simple. We're trying to keep it simple, and if there's any sort of coronavirus, then we'll just say it's a suspected corona, and make sure to put on the full protective gear. The dispatchers behind us here are doing an amazing job of screening the calls, trying to understand through the technology we have here what the patient has even before the volunteers are dispatched. We have technology here that the patient, while calling from the house, will receive a text message or a WhatsApp message with a link that they can press, and it will open up a live video chat with them, so we can actually see them and try and talk to them on the phone, understand the exact situation, and make sure our volunteers we're sending the right volunteer with the right certification, and of course protected. So a just general update, if we're talking about that already. So general update from the field. We're talking about, sorry, just a minute. Hold on 1 second. So sorry about that. I have to deal with a real emergency here. Bluebird. So I'll just give a general update of what's going on now in the field. And we got to understand that also the volunteers themselves are under a tremendous amount of stress. The idea that you're going out into the field to see a patient that you don't know. Does he have COVID-19? Is he a coronavirus patient or not? Those are it's very stressful for them. And going with that kit, that protective gear, even though you're protected and everything, still you need to understand that you're going back home to your family afterwards, and you need to go back home to your community, and you want to make sure that you're leaving home safe and coming home safe. And this is happening, I would say, we're at numbers of about 1,800, almost 2,000 calls a day. We have an up and down. It also depends on the media coming out. As soon as there are more dramatic measures coming out for the public to respond to, we see the instant reply on the dispatch screens when calls start coming in, with people more concerned and looking for more information. So the government, Marjorie, is not supplying meals for people in need. The social services in the municipalities work with different organizations which provide food for the needy through different channels. What they do is more coordinate with them and us as well. As a non-for-profit volunteer organization, we're working in full collaboration with many different non-for-profit organizations in the field which are providing these services, as we see them when we walk in to their houses. Eddie, can a person be tested for corona at home if they have symptoms? So the question is, the answer is absolutely yes. All corona patients are tested at home. As a generalization, if you are diagnosed over the phone with suspected corona, then what they do is they take your information and will send someone over to your house. This can take sometimes a day or 2 or 3. There are no self-tests that you can buy in the pharmacy. There are no self-tests that you can call someone that knows someone. You really got to just wait in line and make sure that they get to you. The government, until yesterday, was doing about 700 testings a day. Prime Minister Benjamin Netanyahu said that they want to rise that number to 3,000 and 4,000 a day, talking about different ways to do it. But unfortunately, they've not reached these numbers yet, though I'm positive that once they are able to reach these numbers, we will see much more significant, big numbers of corona, positively tested corona patients in Israel, and much more as multiply the amount of people in quarantine. So, Robert, is there any difference calling 122 or 101 an emergency? The simple answer is it's a matter of time. Any call that comes to 1221 will be taken in. Emergency instructions will be given to the patient, and simultaneously the dispatch right here behind me will notify 101 in order to dispatch the ambulance, while our system over here with our Uber system will dispatch the nearest by responders to the scene, and an ambulance in areas where we do not have an ambulance from Magen David Adom to the scene. Also, the 101 line is overwhelmed many times because of many people calling the government information line, the star 5400. So I would say it really makes no difference. I think that the calling here will just get you the first responders in the community that are your neighbors, the people that are right around you, get to you much faster in order to respond and respond to your emergency. So the rule is that the Ministry of Health about quarantine is if someone develops a fever and has not been exposed to a known coronavirus victim, or has not come back from a flight from abroad or whatever it is, anyone who develops a fever, anyone who develops a shortness of breath a little bit, and a cough, are ordered to self-quarantine until 2 days after these symptoms disappear. So if you've not been officially exposed and not been in quarantine beforehand, but developed a fever or cough or like shortness of breath, then you need to self-quarantine and wait for until 2 days after your symptoms disappear. Is there any sort of response to the mental health effects this quarantine period is inevitably causing? So it's understandable. It is totally understandable. People are put in quarantine. It is a long time. You're away from your family. You're in the same house, but away from your family. you're in your house and you can't go out. Actually, but nobody can go out of the house anymore. So it's basically just staying away from your family. It's tough. There are different services that are provided. I know that in extreme cases, we also help with our psychotrauma unit if something happens dramatic, but not as a generalization to anyone who's sitting in quarantine. There are official services, mental health services in the government with an emergency number that you can call and get professional psychologists online and talking to them and help you through this process. So the list of supplies, I think in this time, it's actually very, very simple. We always need everything because at the end of the day, United Hatzalah is 6,000 volunteers doing almost 2,000 emergencies every single day for free, volunteering in the community. It's all done for free. It's all for the mitzvah, for the good deed of helping your neighbor. But I think that these times are really, really focused on the emergency situation that we're dealing with, and that is the coronavirus outbreak. And as such, I see them as a responsibility. For me as director of operations, the biggest responsibility, and the reason I have not slept in 2 weeks, is that I'm worried about the volunteers. I'm worried about the dispatchers back here. I'm worried about the volunteers in the field. I need them to be protected. I need to make sure that each one of these volunteers has protective gear and as many kits as he needs. These are single use, you throw them out. And it is so important. So anyone who can help, just get onto this page on the bottom right here and help and support with whatever you can for this campaign and the protective gear and life-saving equipment that we need in this situation. So Aviva, great question. It's a big question. As we're seeing numbers slowly rise of people that are recovering from corona, and we hope that we hope to see those grow much faster than the numbers of the people being affected. So what the doctors are saying today is that technically you're immune, but I guess only time will tell. The whole virus has been around only for a very limited amount of time, and there isn't enough research to actually prove that this is true. But they're saying that anyone who has recovered from corona is protected. But I would recommend stay anyway at home because those are the orders, and we're talking about just staying away and making sure we don't want to take any chances. So even if you're immune, we're very happy, but we don't want anyone being further affected. So if someone you saw a week ago, Shani, tells you he has a fever but feels fine, should I self-isolate for 14 days? We had just a question like that just a little bit before. So if you knew someone a week ago that had a fever and it went away, and you're a week later and you're feeling fine, and they had no exposure to a known coronavirus patient, then as far as I know, you don't need to. But I would definitely reach out to *5400 in the Ministry of Health and ask that question. You'll get the answer by the epidemiological experts of the Ministry of Health. I'll say the number again is *5400. That is the line for any information of the Ministry of Health here in Israel for any question regarding corona. So, John, can I tell you the difference between shortness or panic attack of the actual virus symptoms, or if I only have so it's very hard to diagnose, especially with a question like that over the Facebook Live. I would actually refer the question to experts or get a doctor to check you out. Obviously, there are panic attacks, but that cannot be ruling out as a generalization that you're not suffering from the disease. So I would just have that monitored and call someone to get information. So Ellie, fantastic question. Do we care about volunteers in isolation? I think that is the simplest question to answer. For the very simple reason, United Hatzalah is a very unique and special family. It's 6,000 volunteers of all different walks of life of the cross-section of Israeli society. Secular and Orthodox, men and women, Jews and Arabs, everyone. And of course, coronavirus cannot tell the difference. So if every day throughout the year we act as a family, furthermore, in a situation like this. If a volunteer of ours goes into quarantine, into isolation, or is affected by the virus, of course, we take good care of them. We make sure to speak to them daily. Our team directors and regional directors and managers of staff make sure to speak to them, send them care packages, and just make sure to help support them so that when they come out, we try to tell them sort of, use these 2 weeks to relax, charge up, because we'll really need you on the field in 2 weeks to relieve other volunteers to go a little bit and rest. So use this time, and we'll try to make your time as comfortable as possible. Like I said, United Hatzalah is the biggest family in Israel, and it has so many different people from around the country in this family. So as the overall call volume increased, so I'll divide that answer into two. So the general answer is absolutely yes. The phone call intake has, depending on the day, depending on the news, has been doubled, tripled, and quadrupled. We're talking about thousands and thousands of phone calls. Of those, has it actually been translated into emergency situations? I would say there's been an increase of about 30%, 20 to 30% on the emergencies, and also this depends on the day, and we'll respond to those calls. But the dispatch center itself has definitely been overwhelmed and doubled, tripled, and quadrupled the amount of phone calls coming in looking for information. Oh, yeah, fantastic question. Yeah, being asked to specify. We're talking about, has it affected the response time? When we're talking about 3 seconds, 4-second response time to the time that the dispatcher picks up the phone, that has not changed. We've added additional dispatchers to make sure that nobody's waiting on the line when they need this emergency help. And our average response time to any emergency throughout the day, throughout the year in Israel, average is about 3 minutes. In big cities, Jerusalem and Tel Aviv and other areas, we're at 90-second response. I think that those times have not changed. When I look empirically at the data coming out of the statistics of this dispatch center, we're continuously monitoring the times, and I say that our response time, both to the phone calls and the response time in the field of the volunteers, has not increased at all. In certain areas, because of the motivation of this situation, we've even seen response times even lower in many cases. Pnina, so how can you help continuing this amazing work? It is very simple, and it's right down here, right along the bottom of the screen. I know that taking this hour to speak to all of you is a break for me, because basically 23 hours out of the day we're busy. Like I said, I'm concerned for the volunteers and our dispatchers, and I think that your support, I know that everyone around the world is concerned. Everyone around the world is feeling this coronavirus outbreak. And I'm not saying that people in other places are having it easier. Actually not. Everyone is having it tough, and this is tough on everyone. And I think understanding that this is tough on everyone, it is so important to come together and help support in this situation. And our volunteers here in Israel that are leaving their houses, while everybody's sitting in the safety of their home, in the safety of their little castle, not exposing themselves to the infection outside, our volunteers are risking themselves. And what we want to do is minimize that risk as much as possible, and protective gear and other equipment that we need for their protection of the ambulances, of the volunteers, and everything else is very sterilizing ambulances, and the dispatch center, which is sterilized every X amount of hours, is clean, and the dispatching posts are all sterilized in order to try and prevent. Your support is amazingly needed. Like we said, we get no support from the government. We get orders from the government. We get the rules from the government. We make sure that our professional level is the highest according to the government requirements, and much over that. But we do not get any funding from the government, and we need your help for this mission right now. We don't know how long it's going to take, but we need this help. So, Robert, in case of total lockdown, will your volunteers allowed to respond for emergency calls? Absolutely yes. United Hatzalah holds a status by the government of an emergency organization and a vital service, thus providing each and every one of the volunteers, according to what we work with them, a certificate that they will all have in their pocket with their ID information along with their volunteer card, saying that they are authorized to move. Should there be a lockdown and police will block the roads and not let anyone out, our volunteers will be able to move around freely and go and save lives within the community. Elisheva, is pressure in your chest a symptom of the coronavirus or only shortness of breath? There are many symptoms for coronavirus. It's not one or all. What I would recommend is actually go online to the Ministry of Health and other outlets that are out there. They're very simple. They have placards showing what are the symptoms. We're talking about cough, shortness of breath. It could be chest pain. It could, and of course, fever. But it doesn't always have to be all of them together or partially. I would go onto the official sites of the Ministry of Health in Israel or of wherever you're watching and joining us from. I would plug into those hubs and see what their recommendations are in that area. And if you're not sure, just call. You can call *5400 for any general information. And of course, if you are in distress and an emergency, you dial 1221 right over here, and one of our dispatchers right behind me will pick up the phone and take your information and make sure that you get the treatment needed. They'll do the initial assessment. Have you been exposed to any coronavirus patients? Did your app notify you? The Alltrack Virus app notify you that that you have been on a track of a coronavirus patient, and of course you'll be referred to treatment in a facility. So I'd like to thank everyone for joining us here this evening in Jerusalem. Back here, I once again want to stress: help, support. Our guys need you. Our volunteers, the men and women from all the walks of life of Israel, need your support to help protect them while they're going out into the community to help people. So everyone, jump on, and whatever way you can, please help support our cause. Thank you very much, everyone, and I got to get back to work in there.